Why does a UTI cause persistent pelvic pain or pressure? Imagine feeling a constant ache or pressure in your lower belly that just won't go away, even after you've finished your antibiotics. That's often what happens with persistent pelvic pain during a urinary tract infection. The main reason is inflammation and irritation of the bladder and nearby urinary tissues caused by bacteria, most commonly Escherichia coli. When bacteria invade the bladder, they trigger your immune system to respond, leading to inflammation of the bladder lining, known as cystitis. This inflammation activates pain receptors in the bladder wall, which sends signals to your brain, making you feel discomfort, pressure, or even a feeling of fullness in your pelvis. The bacteria don't just cause inflammation, they also damage the cells lining your bladder, called urothelial cells. Certain bacteria produce harmful substances that weaken this protective barrier, leading to cell damage and death. This damage can make nerve endings in the bladder more sensitive, amplifying pain signals. Some bacteria releases molecules like lipopolysaccharides that interact with receptors on bladder cells, further increasing pain perception even if the infection seems to be clearing. In some cases, the inflammation from a UTI can lead to changes in the nervous system itself. This can cause ongoing pain that persists even after the bacteria are gone, a phenomenon similar to nerve sensitization. This is why some people experience chronic pelvic pain or pressure that lasts long after the infection has resolved. Recurrent urinary tract infections are linked with conditions like interstitial cystitis, which involves bladder pain and pressure without an active infection, suggesting that nerve and tissue changes may play a role. Persistent pelvic pain can also involve nerve irritation or damage in the pelvic region. Nerves like the pudendal nerve can become inflamed or compressed, especially if infections happen repeatedly. This nerve involvement can worsen sensations of pain or pressure and make the discomfort feel more constant. People with a bladder infection often notice symptoms like a burning sensation during urination, urgency, frequent urination, and sometimes blood in the urine. These symptoms, combined with pelvic pressure, can be quite distressing. If the infection isn't treated promptly or effectively, the ongoing inflammation and nerve changes can lead to long-lasting discomfort. Understanding why a UTI causes persistent pelvic pain highlights the importance of early diagnosis and treatment. Proper medical care can help reduce inflammation, prevent tissue damage, and lower the risk of developing chronic pain conditions. If you experience ongoing pelvic discomfort during or after a urinary infection, it's essential to consult a healthcare professional. They can evaluate for other underlying issues, including bladder inflammation or even more serious conditions like bladder cancer, which can sometimes present with similar symptoms. Taking care of bladder health involves addressing infections promptly and monitoring symptoms carefully to prevent long-term complications.